Everyone. We're so excited to have you here today. We are here obviously to chat about Halo skin resurfacing, which we are super excited about. And we have quite the team here to chat with you about it. So um, just a reminder, if you haven't been to one of our webinars before, I will be muting your microphone and then also turning off all cameras that are not for people presenting, just because it makes it a little bit easier to follow who's speaking and it doesn't distract from the presentation. So we really appreciate you coming. It's not a jab at you. We just want to make sure that everybody has the best experience. Also, if you have any questions, please feel free to put those in the chat box below. We're going to be kind of going through the presentation about the technology and the patient experience with this procedure. So that's going to be the best way to get your questions answered, and we'll try to get to those. Also, we have great offers for you for the Halo procedure today. So in order to take advantage of those, and the easiest way to go about that is I will post a link to our online store to purchase a deposit, which will lock in the discounted pricing for you because that ends at the end of the day on Friday. It also locks in the complimentary chemical peel that you will receive for purchasing after attending the webinar. So some great deals we have for you today. So I'm going to start my long welcome of all of our lovely guests here today. So first and foremost, I want to thank Dr. Miriam Hansen for joining us today. She is the cosmetic director at Sanova Dermatology, one of the founding members. She also is an aesthetic mastermind. She's had experience with a wide range of injectable and laser procedures, as well as dominating in the general dermatology market. She's amazing all across the board. So we're so excited to have her here today.
You, Taylor.
A great lead-in. Woo! And then I also have Misty Gray, registered nurse, who is acting kind of as our, she's our aesthetic nurse at the North Austin location. She also has had a hand in many of the laser procedures that we offer and aesthetic procedures we offer, including Halo. So we're so excited to have her here to talk about the patient experience. We also have Caitlin Sharman, who is at our Steiner Ranch location. She's a licensed medical esthetician who has many years under her belt of doing laser procedures. And we are so excited again to hear about the great experience that she's had with this procedure and the results that she's seen. And last but not least, we have Neil Angel with Saiton, who is going to speak about the technology that Halo offers and how it is your go-to skin resurfacing treatment. So thank you for dealing with this long spiel. And I'm going to toss the baton over to Neil and let him kind of start talking about what Halo is exactly.
Hey everybody, welcome to the Halo webinar. So we're going to get started a little bit. If any of you guys joined us yesterday, we talked about BBL and Forever Young BBL and just kind of, the benefits of what that treatment can do for your skin. And today we're going to transition to more of Halo and the differences between the two, and then how you can actually use them together to get even, a better result. So let's see here, trying to advance the slide. Let's see. Okay, here we go. So as Taylor said, I'm Neil. I'm Saiton rep for Sanova Dermatology. So I work closely with them with their laser treatment procedures that they do off of our device. And, as we talked about kind of yesterday, BBL is really the device that they use when discoloration, pigment, sun damage, redness is the concern of patients. And you can see here, this patient here had a lot of sun damage and just how much more youthful their skin looks here on the right by just getting rid of those years and years of sun damage. And then this was a patient we talked about yesterday with the combination of reds and browns and just evening out that skin tone. We also talked about the maintenance side of BBL, and for patients that do multiple treatments a year for over a 10-year period, just what the long-term effects of this treatment can be to your skin. And this was a patient that was 38 over here. This is her skin at 49 after about 3 treatments a year. And you can see it's just much more youthful, brighter, shinier, healthier, plumper. So, just to kind of recap that, but where we left off yesterday with BBL and where it ties into Halo is with this patient right here. you could see this patient had a BBL treatment, and yeah, the brown spots are gone, but this may not have been the right treatment for her. I mean, she has a lot of textural issues, deep wrinkles, things like that, where, you know, she'd have done something like maybe 2, 3 halos and really smoothed out those wrinkles as well as gotten rid of the sun damage. Then we could have gotten her to a point where she could just maintain with the Forever Young BBL. And so that's really where Halo comes into play. Whenever you're talking about the concern of it being more textural, I always like to say with Halo, you know, Halo does a little bit of everything. And this patient right here is a great example where, you know, a lot of sun damage, fine lines, wrinkles, large pores. You know, she's dealing with some laxity, some upper lip lines. And, you know, this patient had 2 halos. And also, like us in full disclosure, she had some lip filler too over here. And the kind of benefit is with this and dealing with a practice like Sanova is they're going to customize this treatment and use all the tools in their tool belt to give you the best result possible. And typically for this type of patient on the left here, to get these results, you know, you'd be talking about pretty deep resurfacing, like CO2 or things like that, with a lot of downtime. And, you know, we'll show at the end of this slide just what the downtime looks like with Halo, and it's super manageable. But, you know, as you can see here, you know, pore size shrunk down, her skin's softer, brighter, you know, smoothed out a lot of these fine lines and wrinkles and things like that. She was feeling so young and youthful. She, you know, she popped the nose ring right back in there and just was ready to go. So, you know, the benefits with Halo, it's the first hybrid fractionated laser. And what the hybrid part is, I always like to say, it's like you're getting 2 laser treatments in one. There's one laser that goes in and just removes a very thin layer of skin off the surface of the skin and smooths out those fine lines and wrinkles. And then there's another laser that goes deeper into the dermis that uses heat to stimulate collagen, elastin, and pull out this deeper pigment and sun damage. And what you achieve is these ablative type results with the more non-ablative downtime. So it's kind of the best of both worlds, right? We're trying to get to a point where patients get the results that they want with as low of downtime as possible. And Halo's, you know, as far as right now, the resurfacing device that does the best job of achieving that. And so, you know, this is a younger patient here. She doesn't have a lot of textural issues, but she does have some sun damage. And you can see on the right, her skin's just brighter, healthier, you know, and some of those sunspots are gone. And this is why we called it Halo. You know, when our R&D team was developing this product and doing a lot of before and afters, we noticed that everyone just had this glowing effect to their skin after the treatment. And that's where the name came from. And so, you know, part of this, you know, if you look at, you know, these patients through a Visia scanner, you know, these scanners look at the sun damage that's underlying under the skin that we necessarily don't see yet, but those things make their way to the surface over time. And eventually, you know, those spots will come up and you'll see them in older patients and they call them sunspots or liver spots or whatever. Those things have been just working their way up to the surface. And so with something like Halo, it can go really deep and just pull out years and years of that sun damage. And this is one of the reasons why her skin here is much more reflective. You know, it's simple physics, right? Like dark objects absorb light, lighter objects reflect light. So if you have a lot of this pigment and sun damage in your skin, and when light hits it, it absorbs it and you lose that reflectivity. So the more of that stuff we can pull out of the skin, the more of this reflectivity that comes back. Dr. Hansen, do you have anything you want to kind of share as we've talked a little bit about just that polishing and what it does for reflectivity and glow?
I agree. That's the results I've been seeing as well. It's just that beautiful sort of brightening of the skin combined with the brown spots and then the wrinkles as well. We do, you know, you mentioned the around the mouth and the lip filler. I have gotten some pretty spectacular results with Halo, doing a full face and then using the setting for perioral rhytids around the mouth to kind of soften those as well. So you can complement it certainly with lip filler. You can certainly go a little stronger and try to do it with Halo as well.
Awesome. Yeah, that's really the nice thing with the Halo treatment is, you know, when you come into their practice, they're going to do a consultation with you and they can adjust the settings in the Halo to really address whatever the concern is. If it's sun damage, if it's wrinkles, if it's pore size, if it's melasma, different things like that, you know, they can hone those things in to make sure they get each patient a customizable treatment that's best for them. This is another one, here, just looking at sun damage. And so this slide's kind of interesting. These are all different patients of different ages, and it'd be more, I guess, accurate of a slide if this was the same person and we just took these photos over 40 years and showed how that one person accumulated sun damage, but that would take a long time. So this was a 15-year-old, this is a 26-year-old, 34-year-old, 43-year-old. And the thing is with sun damage, it's just additive, right? You just keep adding to it. We're not born with this, but from years and years in the sun, we just build up on it. And there's, until we do something to pull out and reverse that sun damage, it's just going to continue to accumulate in our skin. And so, this was a patient after 2 halo treatments, looking at the sun damage, and it compares that to a 15-year-old, but it just, the biggest takeaway here is just to show like it's reversing years and years of that sun damage. So it's another patient post 2 halo treatments. This patient kind of has, a little bit of melasma. Same here. And just a really nice brightening and polishing effect. And so, melasma is a very tough thing to treat. And there's a lot of people that, are very cautious with lasers to treat melasma because you don't want to make it worse and there's no cure for it. But with something like Halo, if we just really, dial in the settings with a low amount of heat, we can, give them some clearer skin for 3 or 4 months, without it responding, more aggressively afterwards. And so, this patient in particular, this was before her wedding. She just wanted her skin to look good for her wedding, not wear a lot of makeup. And, you can see here it achieved those results, even if just, for a few months. And then wrinkles. Part of the injury that Halo is causing is all that it's doing is just kicking in your body's own natural healing response. It's creating these micro little injuries, and then your body does the rest of the work. And so part of that, when you create this injury in the skin, some of the response that's being kicked in there is your body's own natural hyaluronic acid. And so, you get this kind of temporary filler effect with Halo, and over time is, replaced by collagen and elastin and things like that. So, and then like Dr. Hansen was saying, if they really hone in and focus in, if upper lip lines and things like that are concerned, they can treat those areas a little bit more aggressively than the rest of the face. Try to smooth those in. This is another lady. I really like this one when it zooms into the cheeks. She's got just these fine lines, wrinkles, just small little cracks. Nothing that severe. But this is one thing that you'll really notice after a Halo treatment. This is the after. Your skin does feel, smooth and soft. It just, it really does a great job with just these light little textural issues. And then pore size as well. So. And then the really nice thing with Halo, especially when you're comparing it to most traditional laser resurfacing treatments, is the downtime that patients, experience after a Halo treatment. We call it social downtime, right? You're not kicking your face with Aquaphor. You don't have to stay inside for a week. It's just more of, you look like you had a sunburn for a couple of days. And then you can see here, day 3, day 4, it starts to get a little peely and sandpapery. And I don't know if you guys can tell, I actually had a Halo at a training event that we had on Saturday. So I'm about in that day 4 range. And, it's a little sandpapery. We get what we call these mends right here, and it's microepidural necrotic debris. And it's just all that pigment that we necrose with Halo that your body's pushing up to the surface, and then it just flakes off. And that's kind of where I am right now. But, still really not bad downtime at all. She had a little bit more aggressive of a Halo, but still you're talking about a 5 or 6 day downtime. It's a little bit more red the first few days, but still the endpoint's pretty much the same. And then, we wanted to spend some time in the combination treatment, using Halo and BBL together. So if it's your first time coming in and you haven't done any lasers and, you really want to jumpstart your results to get to where you want to be quicker, a lot of times by combining these two, we can really get your skin back to a place where it's looking more youthful and healthy. And then we'll get you on to like more of, just some lighter maintenance type of treatments. And so, This was a gentleman here, had a Halo BBL combination, obviously just a ton of sun damage, as well as some textural issues. And on the right is the skin's more pink. It's more healthier looking. It's softer. It's smoother, and obviously, sun damage is gone. This is another Halo BBL combo. Another Halo BBL combo. And the great thing with that combination is BBL really works on the surface of the skin. It picks up a lot of the superficial pigment that you see on the surface. And then Halo goes much deeper with these fractionated channels to hit some of that deeper pigment, sun damage, and also smooth out some of the texture stuff. So it's a home run when you're combining them together. And we were just going to play this quick little video here for
Halo
you guys.
works by using 2 laser wavelengths to synergistically repair and rejuvenate your skin. The new integrated cooling system helps cool the skin during the procedure to make it more comfortable. Constant temperature monitoring of the skin ensures a safe and more accurate treatment. One laser targets the epidermis, the topmost layer of the skin, to reduce pigment and restore your glow. The other laser targets the dermis, the bottom layer of the skin, and removes years of sun damage from deep within.
And then this is a quick little video if you just guys want to see kind of how the treatment looks. And then just well, just kidding.
Technical difficulties are fun.
Yes.
So while we're figuring out if that's something that we can do, I do have a quick question for Dr. Hansen. What would you say the ideal candidate for a Halo procedure looks like?
I mean, it can be a variety of different patients, honestly. It can be, the younger patient that has a little bit of sun damage and just wants to brighten the skin. It can be an older patient that has some browns as well as some wrinkling of the skin. Some of the photos he showed, there was one treatment with just to kind of brighten. I would say if we're looking at cheek rhytids or around the mouth, we're looking probably at 2 sessions. But yeah, I mean, it's a variety of different kind of patient populations. The melasma treatment, we do have to go, like he mentioned, a little bit lighter. So that's one where we do sometimes up to 3 sessions where we'll space them out just to really kind of get layer by layer, but keeping the skin really safe. But I mean, really all ages and all different kind of skin concerns. It's great to kind of start, like he said, with a consultation, and then we would sort of make a treatment plan customized to the patient's, needs.
Definitely. And I have another question here about deep acne scars. How does Halo play a role with acne scarring?
That's a great question. So every patient with acne scars is different, and we always evaluate, each acne scar patient differently as far as are they colored, are they red, are they textured, are they tethered. So it can also often be a combination approach with acne scarring where we could definitely do something like Halo to resurface the scars. Also combine microneedling, B-beam, which is a red laser. So it certainly has value in resurfacing, breaking up those sort of scar tissue, creating a little bit of little baby trauma in the scar, and then kind of rebuilding the skin. But not every acne scar patient would be right for Halo either. So it just kind of depends on what the scars look like. Again, the type of scar and where it is in the skin. But yeah, for some acne scar patients, it's definitely a complement to some of the other treatments that we'll do for that.
Great. I do have a question for Caitlin. I'm going to pass it over to you. What do you mean by downtime? Can you go out with a hat, or do you need to stay inside for 5 days?
So as far as downtime, I think, typically what I tell patients is, sunscreen, makeup, you can wear day 3, but, the first kind of portion of it, you want to keep the skin as clean as possible. So, I mean, normally you have a little bit of swelling the first couple of days, day 3 through 7, you definitely, put on your sunscreen, wear your hat, be diligent about it. But when I've had the 2 that I've had, I've been out and about, just, make sure you're wearing, good sun protection. I think that's very important to protect your investment that you just made.
Yeah, definitely. I agree. One of the questions that I personally had was, and I kind of asked this with all of our procedures, is this like a one and done, like I've done it and my face is gonna be perfect forever? Or is this something where you would need to make sure that you take care of your skin afterwards, and this is just gonna be kind of like a cog in the wheel of your anti-aging routine and process?
Yeah, I think unfortunately there's no like one and done treatment. So it's always going to be kind of maintaining and keeping up with everything. But the Halo, if you do in combination with BBL2, that's a really, really great jump start to kind of get your routine going for you.
Awesome. Well, thank you. I have a question now for Miss Misty. Is Halo only for the face, or can I use it for other parts of my body?
You can use it on other parts of your body. We do quite a few combinations of face, neck, and chest. And that seems to be a good combination. Some people just want to do their chest. So we've done just chest. We have some people that do face and neck, but you can theoretically do them all in one day if that's something that you would want to do.
Definitely. And that sounds about kind of what we've talked about. And I know that I harp on this, but something that I really love is meeting with your esthetician or your provider, whether that be a PA or a doctor, to decipher what the best treatment plan is for you. And that includes trying to decipher as to whether or not areas of concern can differ based on what you're looking for, and then also what the treatment is capable of treating. I do have a question that maybe anyone can answer. It has to do specifically with oil therapy, but maybe you can kind of loosely disguise it as, if I've had a treatment done, another treatment of any sort, specifically oil therapy is what they're asking for. How long should I wait until I do a halo?
I would say probably the 3 months until you got your final result, and then do the treatment.
Dr. Hansen, do you have anything to add to that?
Um, for keeping it simple, I would say yes. I mean, if you're looking at therapy, as just a standalone, you'd want to wait 3 months. I think from a safety perspective, you'd probably be fine to do it within a month's time, if you want to tackle it. But, if you're saying, okay, let me see what the oil therapy did for me, yeah, it'd probably better to sort of track those with photography, before and afters. But yeah, I think if you come in to your face a month later and wanted to throw on your neck, I mean, it certainly wouldn't hurt.
Perfect. Well, that's great. Yeah, I definitely think it depends. And that's one of those key things about coming in for your consultation, is deciphering, are you wanting to see full results from one treatment before moving to the next, or are you fine to just start the whole game and keep running with it? Let's see. Another question that I have here, and I'll give this one to Dr. Hansen. How long does one treatment, quote unquote, last before you need another treatment?
So that's a great question. It really depends on, again, what we're hoping to achieve. So in a couple of those before and after pictures, it was a younger patient who had some superficial brown spots, a little bit of fine lines. And so one treatment really brightened the skin. And as Neil mentioned, there's maintenance. It may be just BBL maintenance at that point. And so in that case, you could be kind of one and done. Unfortunately, our aging process continues, and that can be as simple as, maintenance with sunscreen for melasma and really great products, or it could be, Halo or BBL. For an older patient with more fine lines and wrinkling, I would say minimum probably 2 sessions. And then, if you're one that's outside, play tennis a lot, maybe once a year, every other year, we'd kind of maintenance it, depending on how quickly, that the skin starts to come back as far as browns and wrinkling. But like Neil showed in those pictures, which is amazing, it goes deeper and it really kind of treats and prevents a lot of the browns that would eventually come to the surface. So I think that's a really good thing to remember, that again, it's an investment in your skin, and then maintenance wise can be a little bit different for everybody, I would say.
Definitely. That's a great response. We have some great questions today. I have another one right now. And whoever wants to answer can just raise their hand. I know before, sorry, we kind of stumbled over each other. I have someone that says, I'm in the sun a lot. Do I need to have no sun exposure before my treatment, like laser hair removal, or am I okay if I had to be outside for work and then come get the treatment done? Who's right? Neil, do you want to take it?
Dr. Hansen's probably better. Okay. But yeah.
I think to be, it's not like, so BBL for sure, we need it as a baseline color, because BBL, it can kind of pull up the natural color in the skin. I would say a little bit the same. I mean, it's not as, I mean, certainly if you're doing a combination treatment, we want you as close to your baseline color as possible. And that's for a lot of different reasons. It can be to pull up to see exactly what we're treating. It can also be the healing process. So if you just come back from a wonderful trip to the beach and your skin's pretty dark, we may run into a little higher risk of hyperpigmentation and things like that, which is not common, but it's just kind of can be part of the healing process when those pigment cells are pretty active with a tan. So I'd say it's always better to be at your baseline color. So doing it now is a perfect time in a sense in the fall and winter time, where we, are out less in the sun. And then, we can kind of tackle it from there.
Definitely. I was about to say, I've heard a little birdie told me that it might be laser season, which is pretty the best season of the year. You get to do all the fun stuff, and something to keep in mind, if you're a little bit more concerned about the response your skin is going to have, we're wearing masks when we're not at home. So, maybe it's the time to take that jump. If you're chilling at home for Thanksgiving this year, Netflix and turkey, or tofurkey, who knows what you're doing. You can sit at home, you can have your men's, as Neil says, and you will just look mighty fine as you're watching A Christmas Story on repeat. I do have another question here. Do you have a recommended time for a halo treatment following a superficial chemical peel? So just to recap, I'm not a physician or a practitioner, but it sounds like previously we kind of said it just kind of depends. Well, maybe this one's a little bit different. I'll let Dr. Hansen answer this one, doing specifically with the chemical peel.
Yeah, I think a superficial chemical peel, it'd be fine to wait, 3 to 4 weeks. I would say, depending on, there's a lot of different definitions of a superficial chemical peel. So if it's a salicylic acne peel that we have, 2 to 3 days of just light peeling, I think, you're probably good to go after just a few weeks. If it's a little bit deeper, kind of superficial chemical peel, getting kind of closer to that mid-level peel, I'd probably wait a full month.
Awesome. Let's see here. Sorry, I'm just combing through to see if I have any questions. I have another one here. This is a great question, and this is for Dr. Hansen. How does this affect other treatments such as dermal filler?
So that's a fantastic question. Like Neil mentioned with the lip filler, there's our faces, we always talk about global rejuvenation, and that can be products, and it can be filler, and it can be rejuvenation techniques, resurfacing techniques, excuse me. So in a perfect world, I'd probably do the resurfacing first and then do filler. But I would say, at least a month, maybe 2 months between, just so you can kind of it doesn't break it down. The fillers generally, depending on which we're talking about, most of our fillers done pretty deep in the skin. And so it wouldn't necessarily speed up the process. It wouldn't be a safety piece. It would just be, it break it down a little bit faster per se. But I think the answer would be it's safe to sort of wait at least a month and maybe even up to 2 months on the filler, and ideally do the halo first and then the fillers.
Perfect. Yeah, I think that's an amazing answer. And definitely, I think it's important to kind of keep those things in mind, because you definitely want to make sure that you're offering as much enhancement to the procedures as you have, or as you can. Caitlin, I do have a quick question for you. What can I do after I've had my halo procedure to make sure that I maintain my results? I know we kind of loosely talked about wanting to take care of your skin in general, but when you have a patient come in after having had it done, is there any sort of other treatments that you suggest afterwards, or any sort of skincare that you would suggest to kind of make sure you get the best results possible?
Yeah, I think it's really important, to come in and have that consultation and kind of make a game plan as to what, might come after halo. But I think BBL is always a really good complement to it, because it can kind of clean up some of those, darker spots that maybe the halo didn't quite pick up as much of. And then also just doing a really good, kind of skincare routine, getting everybody set up for success as far as, what they're using in their home care. And I think it's just really important to just have a good game plan as to what, they really want to target and treat, and go from there.
That's perfect. Yes. I do have a little bit of a trickier question, Dr. Hansen, and then I think that unless I have any other questions pop up, this may be the last one. What is the difference between blue light therapy, BBL, and halo? So this is kind of a multi-pronged question.
Okay, that's a great question. Okay, so blue light therapy, let's start with that one, is called photodynamic therapy. And it is typically, we use that as an in-office procedure where we're targeting precancer spots in the skin. So the sun does a lot of different things. It creates brown spots, it creates sometimes precancer spots, and even skin cancer spots. So if a patient comes in as for a visit and they have a lot of precancer spots, sometimes, and then they have a lot of brown spots with it, we'll say, let's start with a full face medical treatment, which would be the blue light, which is this two-step treatment where we put a solution on the skin called Levulin, and that sits in the targets the precancers, and then we put you in front of a blue light for 16 minutes. That activates the precancer spots. It looks like a sunburn reaction, and then you do get a little bit of mild peeling. It doesn't necessarily affect your browns. It doesn't necessarily affect your wrinkles on the skin. It's really just going after those precancer spots. And sometimes you'll get a little bit more spots that pop up in the areas of more sort of actinic, we call it actinic damage. And so the main, again, it looks like a sunburn. You'd have to stay inside for 2 days, and then you get a little bit of light peeling. And that treatment gets stronger by the amount of time we leave the Levulin on. The light therapy. So in a perfect world, if you got a lot of actinic damage, I would say start with the medical side and treat the precancer spots. And then you can move on to either BBL or halo. Neil, I think, did a great job kind of differentiating a little bit of those. So, but BBL is going to target the sort of superficial spots in the skin. If you don't have a lot of wrinkling with your skin, it's just more browns and reds, and that would be a great next step, would be BBL. If I'm a patient that has a little bit of browns and reds and more wrinkling, then I would consider the halo over the BBL, or combining the two, just as like that really great before and after, which the patient had those brown spots. You remove the brown spots, which look amazing, but then you notice the cheek wrinkling as well. So, we always want to match every patient's expectations. And so in that case, like you mentioned, I think, doing some blue light therapy if they had some actinic damage, and then following with the halo after that.
Perfect. Yeah, I think that's a great response. It's a great way to kind of segue throughout those things. So great question. I think that unless anyone has anything else to add at this time, we are done for today. Like I said previously, if you want to purchase your deposit, it locks in the pricing. If you are interested in halo but not certain if you're a great candidate for it or if it's what you're looking for, feel free to purchase a deposit, because it will lock in all laser pricing, and we want to make sure that we do, as we've said many times, what is tailored to your skin. And I know that all of the estheticians and providers at our locations are more than happy to talk with you about what the best thing would be for you. So the link to the deposit is in the chat box. It's also in the email that went out before this, and will also go out after this as kind of a recap and thanking people. So I just wanted to thank all of my co-hosts today for being so informative and sharing their wisdom. It's so great being with you guys virtually. I missed you guys. And thank you for everyone who showed up today to support this and to learn about this. This is just such an exciting experience, and we're so happy that we were able to bring this to you. So as I said, purchase that deposit, schedule your appointment to come in, and take advantage of laser season. And 'tis the time.
Is the laser season.
It is laser season. But thank you guys so much. Have a great one.
All right. Bye-bye.
Bye.
Bye.